Have you ever wondered about the difference between rhinoplasty and non-surgical rhinoplasty? Well, let's dive right into it. Rhinoplasty, also known as a nose job, is a surgical procedure that changes the shape of your nose, whether it's to correct a functional issue or purely for aesthetic reasons. It's a permanent solution that involves an incision, reshaping the bone and cartilage, and a recovery period. On the other hand, non-surgical rhinoplasty is a minimally invasive procedure that uses dermal fillers to adjust the shape or smooth out imperfections in the nose. It's a quick and temporary solution, with no downtime. Both procedures are art forms in their own right, with the power to transform and harmonize facial features. But like any art form, they require a skilled hand and a keen eye for balance and symmetry. In the next few minutes, we will delve into the world of these two procedures, their pros, cons, and all you need to be aware of. Let's kick things off with rhinoplasty, also known as a nose job. This medical procedure has been around for quite some time, and it's become a popular option for those seeking to alter the shape, size, or function of their nose. Diving right into the positives, rhinoplasty does offer some distinct advantages. First and foremost, it provides permanent results. Once you've undergone the procedure and the healing period is over, the changes to your nose are there to stay. This can be a major plus for those who are looking for a long-term solution. Another significant advantage of rhinoplasty is its ability to correct more severe nasal issues. Whether it's a pronounced bump, a crooked bridge, or even breathing difficulties caused by structural problems, rhinoplasty can offer a remedy. It's a versatile procedure that can be tailored to address a wide range of concerns. But, like any other surgical procedure, rhinoplasty does come with its downsides. The need for general anesthesia is one of them. This means you'll be put to sleep during the operation, which can be a daunting prospect for some. Not to mention, it adds an extra layer of risk to the procedure. The recovery time for rhinoplasty is another aspect to consider. It can take anywhere from a few weeks to a couple of months to fully recover. During this period, you might experience discomfort, swelling, and bruising, which can impact your day-to-day activities. Lastly, there's the potential for complications. Although it's relatively rare, there are risks associated with rhinoplasty, including infection, nosebleeds, or even dissatisfaction with the final result. It's essential to have a clear conversation with your surgeon about these risks before making a decision. In a nutshell, rhinoplasty is a powerful tool for transformation, offering lasting results and the potential to correct significant issues. However, it does require a considerable commitment regarding time, discomfort, and potential risks. Now that we have a grasp on the rhinoplasty, let's shift gears to non-surgical rhinoplasty. Non-surgical rhinoplasty, on the other hand, is a bit different. This procedure, often known as a liquid nose job, involves the use of injectable fillers to alter the shape of the nose. Now let's delve into the upsides and downsides. Starting with the positives, the most significant advantage of non-surgical rhinoplasty is that there's virtually no downtime. You can walk out of the clinic and return to your daily activities almost immediately. This is a far cry from the weeks of recovery required after a surgical procedure. Another advantage is the lower risk factor. Because it's non-invasive, there's no risk of surgical complications like infection or bleeding. Plus, if you're not happy with the results, adjustments can be made. Some fillers can even be dissolved completely, offering a safety net if you're not quite satisfied with the outcome. However, it's not all sunshine and roses. Non-surgical rhinoplasty does have its limitations. For starters, the results are temporary. Fillers eventually dissolve, which means you'll need to return for touch-ups if you want to maintain the new shape of your nose. This could potentially turn into a long-term commitment of time and money. Additionally, there's a limit to the changes that can be made with fillers. Non-surgical rhinoplasty can smooth out bumps or fill in areas, but it can't make a large nose smaller or significantly alter the nose's structure. If you're seeking a dramatic transformation, surgery might be the only way to achieve your desired results. Lastly, there's the potential for allergic reactions or dissatisfaction with the results. While rare, allergic reactions to the fillers can occur. And despite the ability to adjust results, there's always a chance you might not be thrilled with the outcome. It's important to have realistic expectations and to discuss your goals thoroughly with your doctor. There you have it, a rundown of both procedures. Now let's wrap things up. So we've covered a lot today. Let's recap. We started our journey today by introducing you to two major procedures that can alter the appearance of your nose. Rhinoplasty, a surgical procedure, and non-surgical rhinoplasty. Both offer their unique benefits and drawbacks, and the choice between them depends largely on your personal needs, goals, and circumstances. Rhinoplasty, often referred to as a nose job, is a surgical procedure that can bring about dramatic changes to the structure and appearance of your nose. We discussed how this procedure can correct both cosmetic and functional issues, such as a deviated septum that may hinder breathing. The benefits are long-lasting, and the results are permanent. However, as with any surgical procedure, there are risks involved. These include potential complications during surgery, a longer recovery time, and the possibility of not being satisfied with the final results. On the other hand, we have non-surgical rhinoplasty, which is a minimally invasive procedure that involves the use of dermal fillers to alter the shape and appearance of the nose. This option can be an excellent choice for those looking for a quick fix, with immediate results and minimal downtime. However, the results are temporary, typically lasting from 6 months to 2 years. And while it's a safer option than surgery, there are still risks to consider, such as potential allergic reactions to the fillers, and the results may not be as dramatic or transformative as those from a surgical procedure. In essence, the decision between rhinoplasty and non-surgical rhinoplasty boils down to a balance between what you want to achieve, how much risk you're willing to accept, and how permanent you want the results to be. Remember, the choice between rhinoplasty and non-surgical rhinoplasty is a personal one. Always consult with a healthcare professional before making any decisions. Thanks for tuning in. Before we wrap up, I want to remind you of something important. If you found this video informative and want to keep learning about such intriguing topics, don't forget to hit the subscribe button. We have a ton of engaging and educational content coming your way, so make sure you don't miss out. It's your support that keeps us going and helps us deliver all this valuable information to you. So don't hesitate, click that subscribe button now, and stay tuned for more. Remember, knowledge is power, and we're here to empower you. Thanks again for joining us on this journey. See you in the next video.